This week on the Physio Foundations podcast, I'm going to have a conversation with Matt Donnelly, who's an advanced musculoskeletal physiotherapist working in an emergency department of a large public hospital in Melbourne, Australia. And we're going to find out more about Matt's role and this role in general, and what Matt does and how this role, which has only really existed for the last 15 years or so, has changed how emergency departments work and how having an advanced practice physio on site can help with things such as reducing surgical waiting times and many other benefits for people. It's going to be a really interesting conversation. I'll be honest with you, I was speaking to Matt today and asking him all the questions I'm going to ask today on the podcast. And I thought, why don't I just record this and share it with you? So I'm sure you'll appreciate it. Matt's a really interesting guest, and we're going to have a really good conversation, so stick around. Welcome back to the Physio Foundations podcast, where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So as I've already mentioned, today I'm talking to Matt Donnelly from Monash Health in Melbourne, Australia. So Matt's working with us here at Monash Uni Physiotherapy for the next 6 months or so as part of a partnership with Monash Health, where he's developing his physio education experience and sharing some of his experience with us, which is going to be really good. And Matt has postgrad qualifications. He's got a lot of interesting clinical experience that I'm going to let him tell you about. And let's get him on right now. Matt Donnelly, welcome to Physio Foundations.
Thanks for having me, Luke. That's a pretty big build-up you gave me there.
You got to have a good build-up. So, so this is the shortest run-up to a podcast. We're having this conversation an hour ago, and now we're doing a podcast. So I really appreciate your willingness to come on and share this with everybody. And it's really good to have you in the department, and good to meet you last week. This is only your second day with us. So welcome on board.
Thanks for having me.
So let's start with you. Tell us a bit more about you, your background and interests and experience and qualifications. Let's do your bio first. And
sure. So I graduated from La Trobe University at the end of 2012. So I've been a physiotherapist for 10 years now, which has been pretty exciting, pretty interesting. I've spent my whole career in the hospital system. I've done a little bit of private hospital work, but mostly in the public health system in Victoria, which has been really cool. And it's given me a lot of exposure to lots of different areas. I've worked in cardio, musc, neuro. I've worked in community rehab. I've worked in rural home-based services. I've done oncology rehab. Lots and lots of different stuff. So last 5 years or so, I've been involved in musculoskeletal roles in hospitals, culminating in the advanced musculoskeletal physiotherapy role, which I've been working in for the last couple of years, which has been great. The advanced musc physio role has been really interesting. In particular, I currently do primary contact emergency department work. So I'm a primary contact clinician as opposed to a secondary contact clinician, which is what a lot of other hospital physios are. Which means that after a person gets triaged, I'm the first clinician to see them and assess them. And so I really get to use my diagnosis skills in an emergency setting, which is really cool. And then I also work in some advanced practice musculoskeletal physio-led surgical screening clinics. So screening people who are on a wait list for, or hoping to be on a wait list to get either a hip or a knee replacement done, or are having spinal issues and have been referred to a neurosurgeon. Just two examples of the clinics that I work in personally, but I've got colleagues who work in shoulder screening clinics or soft tissue clinics or lots of other advanced practice clinics at the hospital.
Let's talk about those, the surgical screening clinics. So they obviously have a bit of an opportunity there to make a real impact on quality of life and in getting someone who needs the surgery urgently and involved with the triage as well medically. Let's talk about that.
Yeah. Or even sometimes the opposite. It's opportunity for somebody who may have been referred to a specialist for an opinion about a surgery, but they actually haven't really given conservative management a good go yet. The amount of referrals we get where a patient's seen their GP, they've had an X-ray that shows they've had arthritis, and they've said, right, off to a surgeon you go. And then we're that first point of contact. And unfortunately, some people can be on that wait list for quite some time before they get to us. But as we all know, there's a huge body of evidence supporting conservative management of osteoarthritis in hips and knees in adults, and a big body of research behind exercise interventions, weight loss interventions, as your first line of treatment, really, before considering surgery. And that's brand new information to a lot of people. And so
that's interesting.
Yeah. So these clinics can be a really good opportunity to discuss with patients, what treatments have you tried already? What are your symptoms like? What's going on? What do you do for work? How much is the arthritis impacting your life? And then having a really good conversation with them about where to from here. And for a lot of people, it might be, oh, you've never seen a physiotherapist before. Cool, let's try that. Let's try lose a bit of weight. Let's try do some exercise. Let's try all these other things. And if it's no good and it's not working and the symptoms are deteriorating, by all means, we can refer on to one of the orthopedic surgeons for more consultation about where to from here. But it can be a really nice way to, give people options and treatment choices, because there's some people coming to our clinic who didn't realize that that was an option.
What's it like for those people who are referred? Do they believe they're going for surgery soon? They're referred to a surgeon, and then they end up in a different model of care.
Yeah, it can be interesting. It depends on sometimes who their primary doctor is, or their own health literacy can determine a bit about it, how much research they've done. Some people have had family members who have had the operation before, or so different people come into it with different expectations. They always get told they're coming into a physio-led clinic, so it's not a surprise that they're seeing us. But it's definitely a really good way of us helping go through the waiting list, because not everybody that has arthritis needs surgery. So if we can help filter out the patients that don't need it, then that really helps reduce public hospital waiting lists. And so the people who really do need it will hopefully get seen sooner.
I think that's a really nice explanation for not necessarily, I was going to say students and new grads, but not necessarily for me as well. For anyone who hasn't been in that public health position, perhaps even working in that role that you're doing, you may not actually understand that impact that you have, not just on people, but for example, on the waiting lists and the overall flow of what's going on. So tell us a bit more about that role. So what was it like before those? So an advanced musculo physiotherapist is your role, and you've got your title from you've got your postgraduate qualifications that you needed to get that role, your master's. What was it like before in emergency departments, before we had a role like that?
So for those who may not have ever worked in an emergency department before, and obviously every health organisation runs slightly differently, but I work in an area of emergency called Fast Track. So it's for, the idea is we're trying to get people in and out as quick as possible. It's for acute injuries that we think are going to be short term. They're probably not going to need to stay overnight. It's things like broken bones, cuts, lawn mowing accidents, or the like, or other bits and pieces. Yeah.
I mow my lawns every week. What should I not do there?
The sharp, spinny things are to be avoided as a general rule. Yeah.
I got that. Okay. Right.
But it's the type of people that we think can be in and out of emergency in a span of a couple of hours. And traditionally that is staffed by doctors. But what the role that I do in ED is, because my whole background and training is in musculoskeletal physiotherapy, it's recognizing that I've got experience with muscle, bone, tendon injuries. And so any of those that come through the door, if I can take the pressure off the doctors by seeing those patients and using my clinical experience to help manage them appropriately, it means the doctors are freed up to treat the other stuff that comes through emergency, like concussion or head injuries, or all the other stuff that we really need their expertise on. But if we can help out with one area, then that really frees up the rest of the system to be well staffed and be able to do things. And it's even interesting there. Monash has also got some advanced nurse practitioners as well, working in a similar way, that they have an advanced scope of practice role. So they can order imaging, they can order tests, and depending on the conditions, they can manage patients independently, just like we can. It's all done under the framework of working with whoever the senior doctor in charge on the day is. So I'm still doing a bit of training and upskilling that area. So I still check if I order any x-rays, I'm usually running it by the senior consultant in charge, just to make sure we're not missing anything. And So there is that really nice support framework there as well. You're not just by yourself. It's very, very much a team role and a team environment. But if we can lend our clinical skills to help, then that really helps flow through emergency as well.
That importance of that team environment is something that's come up again and again, particularly on the new grad episodes on the podcast with our new grads, many of whom I know as former students, talking about just the importance of learning how to work with a team. So what's the what's the importance of the professional relationship there with the doctor in your role?
So important. We work together every day. If we didn't have a good working relationship, it just wouldn't work. So they need to trust us to be able to look after the patients we're looking after, and we need to be able to go to them when we need to escalate things, or if things are coming up in our assessment, they're going, I think this is actually showing signs of something a bit more sinister than just regular back pain. I think we actually need to investigate this further. I'm worried about these red flags. Do you agree? And if so, could we please get some more thorough investigations done for this patient, because this actually sounds pretty serious. And they're really, really good at being supportive and helping with that. So talking to your colleagues is so important. It's probably one of the best things, best skills you can develop as a new grad physio, is getting to know the people in your workplace and trying to build a working relationship with them.
Yeah. So having that real knowledge of the role of the doctor, what the scope of what a doctor can do and what they can't do, and vice versa.
Or even probably just as importantly is knowing my own scope of practice and knowing my limitations as a clinician, because there's definitely in this role, there's things I'm not allowed to do. There's things that are outside my scope, the things that are inside my scope. And so really being aware of my own limitations, or even my own even area of expertise in particular clinicians. If I see something I've never seen before, I'll be asking questions. I'll be talking to the doctor. I'll be talking to colleagues. There's always opportunities to learn. So I think not just knowing what other people can do to help, it's really important to know and have that self-awareness and self-reflection. What don't I know? What can I learn? What can I explore more today?
When you first started, was it more difficult to ask questions, and did you find it took some time to learn the boundaries of the role, and you didn't want to seem like you didn't know things? We've talked about that in the past with
I was really lucky. My first role in a hospital was at a semi-rural hospital, which everyone was lovely. I had a really supportive team. The allied health staff I worked with, the OTs, dietitians, were all fantastic, really easy to talk to and ask questions. And even the medical and nursing staff, again, really supportive and happy to answer things. There were some fantastic consultants out of that hospital who were really happy to talk to even me, a new grad physio, and impart their wisdom and experience. So I got lucky in that respect, but definitely it was very, very normal to have the nerves walking into your first full-time job for the first time and trying to figure out who everything is and where to go for stuff if you need help.
I want to just explore that a little bit more, because it's such an important thing. Asking questions. Okay, we all agree then we need to ask questions. Sometimes there's some barriers to asking questions. We've discussed that previously here, but what's some strategies and tactics you can use as you getting into a role like this? How do you break the ice with people and their respect? And how do you ask questions well, do you think?
Something I've always noticed that goes down really well, no matter what workplace you're in, is being proactive with stuff. So if you can get on the front foot early, and even if you can demonstrate that you've had to go to the best of your ability to solve your problem, whatever it is, or solve your conundrum, but then recognize your limitations, people are a lot more on board with helping you fill in the gaps. So if it means you're going to a senior physio, say you have a question about BPPV assessment and treatment, for example, you're like, look, I've gone over my notes from last year, I've watched all the videos, I've done the training manual from this course, but I'm still really struggling with this concept. Do you think you could help me or show me something? And that comes across a lot more professional and a lot more of someone that's engaged and wanting to do better than if you just roll up to your senior one day, I haven't got a clue about this, can you show me? Which, depending on the environment and system, that's still not the wrong thing to ask or to say. But if you can demonstrate that you've been proactive about things and you're really trying, then often people are a lot more inclined to help you.
I'm sure we could apply that to physio students as well on their clinical rotations. And so you've done 10 years as a clinical educator.
Yep.
Tell us about that, and so tell us about your experience there.
Yeah, so almost as soon as I finished, I ended up supervising students. Again, working in a small rural hospital, there weren't a big pool of clinical educators to choose from. So I've been teaching basically my whole career, which has been really interesting. And it's always good getting to know students when they come out, watching them grow and develop and learn things, and getting more confident as they go through placements is always cool to see as well. And I guess it's always the students that are more proactive that do well, and it's the ones who come ready to learn and ready to ask questions and ready to really throw themselves into the clinical placement are the ones who do quite well. And it's always really, it's fun working with those students because they're interested and you can have great discussions. And it's always really enjoyable being a clinical educator in those times.
Let's put ourselves in the shoes of a student who is feeling underprepared. I didn't say imposter syndrome, because that phrase is going out of fashion, isn't it? Well, don't we all have that? But they're feeling, maybe the first clinical placement, they're feeling a bit underprepared, and who doesn't? And they're also feeling that nerves are a big factor here. And your advice here is, even if you feel that way, still be proactive and then still ask those questions. But what tips could you give the students who are feeling nervous?
The best thing you can do is review the course material that you've gone through. So if you know that you're going to be working in a acute orthopedic ward for your next placement, and you've only got a couple of days between your last placement and your next placement, as nervous as you might be, if you're feeling a bit underprepared or a bit underdone, even just spending some time going over your lecture notes and going over what you think might be common conditions you're going to see in X block, that little bit of extra prep time you do might be the difference. You might, if you spend a bit more time going over your content, then that might be enough to help you be confident enough on day one. And then once you get onto the ward or get into the clinical placement and really see what conditions are around, what conditions are really common, what conditions are not really, really common, that can really help you prioritize what you need to revise, what you need to be stronger at. So if you walk onto an orthopedic ward that specializes in joint replacement surgery and you're going to see a total hip and a total knee replacement every day for the whole of your placement, make sure you're confident with that stuff. It's a no-brainer. And so I guess paying attention to the placement you're on and what is normal for that placement, and then making sure you're good at that stuff, is just such an easy thing to do. And that, if you know the content well, it's going to help your nerves, because you won't have to be thinking or second guessing everything you do it, because you're familiar with the content. And that's honestly the biggest part of it, is making sure you're comfortable with the content as well. And then you can focus on all the other skills you need to learn on placement, like talking to patients, talking to nurses and doctors, and clinically reasoning through problems. But if you haven't got that basis of the basics, then it's going to make everything much harder.
And that all falls under the heading of being proactive you mentioned before. And we could add to that being honest as well, because we all want each other to do well, and we're all on the same team, we're on the same healthcare team. So just say, well, I'm nervous, but this is my plan. This is what I've been doing about it, rather than just saying, well, I'm nervous, what's next?
Yeah.
I'm sure you would appreciate that.
Yeah. There's a big ethos that gets thrown around education in a workplace environment. And a common phrase you might hear is adult learning or adult learning principles. And what it basically means is that you're a professional now. Like you need to take responsibility for your own stuff. If you're not good at something, get better at it. If you're struggling with something, read up about it. If you want to know more about something, go to a PD course about it. Like it's really great when you're at uni and you have access to some fantastic lecturers and tutors and some really good supports, which is amazing. But once you finish, it's all on you. And if you want to be better at something, you have to go find it. You have to go chase it. And the people that do well in a professional environment are the ones that are proactive with that stuff, and the ones that seek out opportunity to learn more, or to, if they're not confident with something, work harder on it, if that makes sense.
Nothing calms the nerves better than starting and being
exactly.
honest and talking to people and having a plan. The adult learning, it doesn't just include learning more stuff. With the mechanism being, well, you'll know more, then you'll feel more confident and less nervous. Part of adult learning is managing your emotions and your thoughts and everything else as well, which is something that just develops all the way through school and through university. So it's really interesting hearing that from you.
Yeah, it's also important to know you're not going to know everything, and that's okay. It's recognizing what your gaps are, what your area of expertises are. Like I've been in Musk for the last 5 years. So if I came across a complicated cardio or neurological patient, I'd definitely be talking to my colleagues and asking for help, because I haven't had much exposure to that over the last few years. But that's also really normal in a professional context. There's going to be colleagues who are incredible experts in tendon rehab, but that doesn't necessarily mean that they're used to dealing with BPPV patients all the time. So there's opportunities always to learn, but don't put so much pressure on yourself that you have to know everything there is to know about physio.
I feel like that's really valuable for students, for new grads who are working in any role, but I find it valuable to think about that myself. And people at all levels are going to be thinking about, well, if I'm changing careers, I could apply that to that as well. So it's really good. Let's talk about knowledge and skills. So as a clinical educator, give us, and you could really say all the knowledge and skills, but just sort of following on from that previous comment, what do you think, if you're a student, you're going out, perhaps you're doing a musculoskeletal placement, what would be the most important foundational knowledge and skills? Beyond just learning the total knees and hips or whatever's on that ward at the time.
Yeah. I guess it's really funny because it's not like a theory, or it's not like you must learn this miracle joint mob that helps 90% of patients. That's not what I'm going to say. It's interesting. I'd say it's the ability to listen to a patient and understand what they think their biggest concern is, and from that, how you can help them. So, which sounds simple, but it's actually it's a real skill. And it's one that I see a lot of students struggle with, because they're trying so hard to remember all their assessment questions they need to ask, all the special tests they could possibly be doing, all the other assessment and treatment interventions they need to be doing. But when it comes down to it, if you can prioritize one or two really key things that the person's come to you today with and said, I'm stuck, I need help with this, or say they come to you and it's 6 weeks since they've had a shoulder operation and they still can't lift over their head. And then they're also complaining of severe pain and they're not sleeping. If those are the two most important things to the patient, if you can find ways to address those things, you're going to get better engagement with them. If you can help them within the session, even better, they're going to feel better. They're going to be able to engage with their rehab more. So just trying to really pay attention to the patient. And then even better, if you can help address their concerns, then that's the most important thing you can do.
That's gold. How do you figure out the biggest concern for somebody? You can ask them directly, but what are some ways that you can figure it out?
Yeah, so sometimes I like reflective listening with patients. So a technique you can do is, once you've finished your examination, you've asked your subjective questions, you're after your objective questions, you can kind of come back and say, all right, from our assessment today, I hear that you're really worried about your sleep. You're not coping very well with the pain at the moment, and you're really struggling to brush your hair at night. And those are the things that are bothering you the most. Is that about right? And then the patient can go, oh, no, I'm not too worried about that. I can't drive my car. I want to drive my car. And then you go, all right, well, let's focus on that. And giving that opportunity for the patient to clarify their issues and their problems is a nice way of summing things up at the end before you start handing out treatment ideas that they may or may not be interested in.
That's simple, isn't it? And it does involve a pause and, of course, the reflection. And sort of bring that loop of reflective listening and then returning to it. And we talked about reflective practice and reflecting on your own practice a lot on the podcast in the past, but reflecting with the patient. It's a vital skill, isn't it?
Yeah,
that's a really good one. Yeah,
and it's really interesting. Especially a common mistake students make is they feel like they can't have silence, or they can't take 5 or 10 seconds to pause to either write something down or just collect their thoughts, or they feel like they need to be talking all the time. But a little bit of silence is okay. Because if you're just rambling nonsense, then that's not helpful. But if you're really listening to the patient and can demonstrate that you're listening, then that's going to be more valuable. There was a study, I can't remember the exact author off the top of my head, but it was something, it was a qualitative survey that was looking at different things that help patients get better or not. And the patient-client relationship was one of the biggest indicators. Not how experienced they were or what treatment technique they did, or it was that relationship was a huge predictor of how well they did. I'm sure you've read the paper and can probably quote me on it. I can't remember the author off the top of my head, but yeah, I just found that fascinating.
There's a challenge to put that into the show notes for people. So exactly. So there's it's powerful to know that someone is listening to you, and particularly when you're in the medical environment where things are scary and foreign and uncertain, and you have a problem that you've come in there about, and then suddenly you've found a connection with a person who's listening to you and who's hit the nail on the head with that reflective listening and has figured out the thing that's of most concern to you. And then you can return to that and make that one of your goals. So anyone listening, not just students, silence is okay. It can be powerful. Just having that silence there, and it's a sure sign that you're doing something. You might just maybe you're thinking about what the most important problem is, but silence is really good for letting the other person speak as well. Sort of,
100%.
which I'm doing right now.
Yeah.
And actually we're recording this via audio. We're not face to face, and it's kind of it's got its problems doing that, because it's nice to be interpersonal in the same room and having a coffee together, but you find you interrupt your guest far less often recording a video conference. I found it's good.
Yep.
So they're really good skills. I'm sure that would apply as well for teleconference and working with people via telehealth as well.
Oh, for sure.
There's problems with it.
Yeah, and we did so much telehealth through COVID as well. Of course, it's nice to be able to see people face to face, but telehealth's not going anywhere. It's a real tool now, especially for patients that maybe live far away or struggle with transport for whatever reason to get to hospital appointments. So it's definitely here to stay, and making use of those communication skills over video conferencing is really important to have.
Absolutely, yeah. So let's talk about where you are now. So 10 years out of university, you've done a lot of stuff. You've done a master's.
Yes, I just finished.
You just finished
last year. Yeah.
What was it in again?
So I did my Masters of Musculoskeletal Physiotherapy through La Trobe,
That's right,
finishing last year, which is good. It was really interesting in terms of career progression, which I can talk about a bit more if you are happy for that, Luke.
Yeah, go for it.
Yeah. So the advanced physiotherapy practice role that I'm in, through the particular hospital organisation that I work with at the moment, they actually have a Masters of Musculoskeletal or Sports Physio as a prerequisite for that job. So certain advanced clinical roles in hospital networks sometimes will highly encourage further study, or certainly look very favourably on candidates who have evidence of higher study or higher qualifications. But for this particular role, this was a prerequisite. You either had to have finished or you had to be working towards it. So in my case, I was midway through my master's when I applied for and was successful in the role I'm in at the moment. And it was the recognition that I'm doing further study in this particular area that would be really important and for the work that I'm doing, which is great. Combined with that as well, I've had lots of on-the-job training, which has been really, really good. And I've been really lucky to have a very supportive workplace for that.
So that's an interesting point that you we're talking about here, with it being an advanced musculoskeletal physiotherapist, at least in our system, and there's other versions of extended scope roles around the world, and some people just do it through necessity in different countries and different systems. But this is not as much as a title and a university degree. It's not. It's
No.
it's a role within an organization, and you've got that
Yeah.
prerequisite to have that advanced training, that master's training.
Mm.
So this sort of leads me to the question, or back to the discussion about what a bachelor's or even any entry to practice, or a doctor of physiotherapy, an entry to practice physio degree, what that trains you for. And so you're in a really good position to talk about this, because as educators in entry to practice degrees, we're commonly hearing people talk about all the things that need to be taught more and more, and need to be taught to an advanced level by the time people graduate. And we have to push back. And it's often from people who haven't actually taught within them the courses where these comments can get it the most polarizing, these debates.
Yeah.
They haven't actually done any university teaching and training. Or teaching, I mean. We and I've asked Jody this before, and on a previous episode, and other guests, what is the goal of doing an entry to practice degree?
Yeah. Yep.
So what do you think the goal is? What's the goal of your first physiotherapy degree?
The common discussion I have with other educators at work is always, when we're talking about students, is would you be happy working with them next year? So the basic premise is are they safe? And what it's safe in of itself is a really interesting concept. What I mean by that is, can they treat the basic patients effectively without unnecessary risk or unnecessary danger to themselves or their environment or the patient? And within that, do they recognise their own limitations and where they need to escalate or ask for help? And if they have those two things nailed, then that usually makes a really good colleague, because you can trust them, and you can trust that they're going to do their job effectively and that they're going to ask for help when they need it, but you can trust them to do the things that they need to do. And even now in my role, I've been out for 10 years, but I'm still learning, still developing. And my senior, who's helping with my training, the biggest thing he keeps going on about is like, as long as you're safe and effective, that's our priority. Like, you're not going to miss red flags in emergency. You're not going to miss life-threatening conditions, because we've really hammered that part of your training, because that's probably one of the most important things in that particular role. But yeah, as long as you're safe and effective, that's probably the priority for graduates.
That's it. I mean, you're someone who's practiced in 10 years across, you said, cardio, musc, neuro, community rehab, oncology. I think you listed some other ones as well, right? Yeah. That's over 10 years. When you do an entry to practice physio degree, you will touch on every peds, geriatrics, so many other, women's health, so many other areas that you need to have basic competency in, but not expertise. You need to be safe and effective. And you hit the nail on the head with that from our perspective as well. And
from the other side of the basics, at a graduate level, you need to be able to help your patients. There will always be new treatments and new ways of doing things, and there will always be the best, highest level evidence of how to do things. And sometimes that might be someone who's got a lot of experience, might be able to help you with particular treatments or interventions for certain conditions. But as long as you're able to help people with the basic skills you have and able to provide improvement to your patients, that's the main thing. Because at the end of the day, it's about the patients. It's not about us.
Yeah, and as you said, the patient and client relationship is the biggest determinant of the engagement and ultimately how far they'll go with their prognosis and success. So, and there's so many reasons for that. If you think about it, if you're feeling nervous and you're doubting all the knowledge you have, if you just reflect on some of Matt's comments and you think about what you need to do, what the goal of doing your undergraduate or your entry to practice training is, one of the biggest things you want to get good at is being able to develop a relationship with the person you're trying to help and being able to figure out what their biggest concern is. And all the knowledge and skills that you're learning are sort of the tools that you use to do that.
And if you're feeling nervous, that's also normal. And if you're feeling like there's things you don't know, that can also be normal as well. My favorite graph in the world is the Dunning-Kruger effect. I don't know if you're familiar with it, but there's the like confidence versus actual knowledge in something, and that people's confidence is often very high at the start, but then the more they understand their confidence drops when they realize how much they don't know. And that's actually a better space to be in than to be overconfident without the knowledge to back it up.
Yeah. Well, you've given us some really nice points to reflect on here. And it's not just for students or new grads. It's really, I found the conversation was really interesting, and I'm sure everyone else will as well. There's plenty more we can talk about. We've got you here for 6 months, so we might have to do this again. But if you are interested in thinking about, say you're 5 to 10 years out of university, and you're sort of thinking about this advanced musculoskeletal physiotherapist role or another extended scope role, people like Matt are the guys you can talk to, and I can if you have questions about this, people have started sending me more and more DMs and comment, not just the thanks for the episode, I'm enjoying the podcast. I appreciate that as well. Thank you everyone who sent that stuff. And go and leave a review and all of that. That's not what drives me. I'm really just here to produce stuff that is helpful for people. So keep contacting me and saying what you want. I mean, Jun, who was on last episode, Jun Sung, said, I'd like to come on. Fantastic. Yeah. So I'm not going to say no to people who have something to say and they want to come on. But more so, if you have a question for Matt or any of the guests, just let me know and we'll continue exploring it in this long form on the podcast. What else would you add, Matt? Any final thoughts on everything we discussed?
It's okay to not know what field of physio you want to work in when you graduate. That's fine.
Yeah, that's a good one.
That's where hospitals I quite enjoyed for the rotating nature of the grade 1 programs. So working in a variety of different clinical areas gave me lots of exposure to stuff. And it honestly took me 4 or 5 years to figure out that I really wanted to be a MUSC clinician. And that's okay. I learned heaps along the way and it was really enjoyable. So don't put too much pressure on yourself to have your career mapped out from the year you graduate. That's fine. And lots of people change their minds anyway. So don't get too stressed about it.
And if you don't know about all the opportunities, that's what conversations like this are for. But lots of things will appear before you as you go along. What you imagine it is in your early years, there may be more to it as you go through.
And there's also lots of different pathways to different things as well. So in the advanced MUSC role that I've got, or the AMPs as we're called, a bunch of us came through the hospital system as grade 1s and then grade 2s and then eventually into grade 3s. And then we've got a couple who work predominantly in private practice that have then transitioned into this role, which has been really cool, having their perspective and experience on things. There's lots of different ways into different career paths if you're interested.
Can people track you down directly if they have questions, or are you a social media person? Or
I'm not really a social media person, but very happy if you DM or email Luke, I'm very happy for him to pass on my details and that I can talk to whoever wants to know more.
That's an easy way to do it. So take advantage of that if you like. Thanks, Matt, very much for this conversation. It was impromptu, but I knew that you would have some really interesting insights for listeners and for me. So really appreciate the chat. Thanks for coming on Physio Foundations.
No worries. Thanks for having me.
So everyone else listening to this, thanks to you. Like I said before, thanks for your DMs and emails and sort of guidance for the content that you're enjoying and what you want more of. Keep that coming, because this is for you. It's a passion project of mine. It's also related to my work as a physio educator and a physio. It's something I'm going to keep doing for a while. But the episodes are for you. So keep sending me what you think and let me know. And send those questions in for Matt if you have them as well. You can track me down in the show notes. I've got all my details in there. We've got @Periton Physio on all the social media for Susanna and I, and I'm @Luke Periton, and I'll reply. So don't be shy. How's that? Careful. I'll start rhyming here. So thanks, Matt. Really appreciate the chat.
No worries. Thanks for having me.
So until next time, this is Matt and Luke wishing you all the very best with your studying, professional development, and lifelong learning.